The thyroid gland. The gland may present abnormalities of function or of size, although there is no correlation between the two. The grossly thyrotoxic patient may have a small gland, and a large gland may be underactive. The symptoms of an over or underactive thyroid may be so insidious that the patient or even their close relatives fails to notice them. The gland secretes tyrosine, that's T4, and triiodothyronine, that's T3, which circulates largely bound to proteins, for example, thyroid binding globulin and prealbumin. T4 is converted in peripheral tissues to move active T3. Overactive of the thyroid gland is confirmed by the finding of high levels of free and bound T4 and T3 with low levels of thyroid stimulating hormone TSH. Primary hypothyroidism is confirmed by high TSH levels, since abnormally low T4 and T3 levels fail to suppress pituitary TSH secretions. Symptoms: swelling in the neck. The patient or the relatives may have noticed the swelling in the neck. Pain is common only in subacute liqueveins thyroiditis, or in the case of hemorrhage into a cyst. Constant discomfort sometimes occurs in Hashimoto's thyroiditis. Appetite and weight. Thyroid overactivity is classically associated with increased appetite and weight loss, although occasionally the hyperphagia causes weight gain, but sometimes the appetite is actually diminished. Conversely, hypothyroidism causes weight gain. Tolerance of heat and cold. Intolerance of heat and night sweats are common but not invariable features of thyrotoxicosis. Cold intolerance is associated with hypothyroidism. Neuropsychiatric symptoms. Thyroid overactivity may cause tremor, irritability, restlessness, overactivity, and insomnia. It may exacerbate underlying psychiatric disorder, and in severe cases, hallucinations and psychosis are described. Conversely, the hypothyroid patient may be slowed and dull, and occasionally depressed, but sometimes quite cheerful, with a so-called myasthenia with. In extreme cases, psychosis may occur. Cardiovascular and respiratory symptoms. Atrial fibrillation, palpitations, and shortness of breath are commonly associated with toxic nodular goiter in the older patients, but may be a feature of thyrotoxicosis at any age. Shortness of breath may also occur in myasthenia, in which pericardial effusion, myocardial degeneration, and coronary artery disease are not infrequent. And a large retrosternal goiter may compress the trachea and cause stridor and dyspnea. Gastrointestinal symptoms. Thyrotoxicosis may lead to diarrhea and, in extreme cases, steatorrhea. In hypothyroidism, there is usually constipation also. Menstruation. Oligomenorrhea is typical of thyrotoxicosis and menorrhagia of hypothyroidism. Muscles. Myopathy, particularly of the proximal and girdle muscles, is a common feature of Graves' disease. Skin and hair. With hypothyroidism, the patient complains of dry skin and thinning hair. Increased sweating is characteristic of thyrotoxic patients, who may also complain of hair loss, particularly early after treatment.